To remove the brain from the cranial cavity, you can see here I have dissected out the bolt of the skull by a saw, by a manual saw. I have given here incision in the skin and the superficial fascia. Then I reached to the skull bones, and with the help of manual saw I have removed the bolt of the skull from the cranium. So this is the bolt of skull you are seeing here. This bolt of skull is showing. This is the endosteal layer of dura mater, you can see, and between the endosteal layer of dura mater and the inner aspect of the cranial balls, you can see these are the middle meningeal vessels. You can see these are the middle meningeal vessels. They present between the endosteal layer of dura mater and the interior of the cranial balls. And you can see this is the site of superior sagittal sinus here. So this is the endosteal layer of dura mater, and you can see very easily that the endosteal layer is firmly adhered to the interior of the bolt of skull. So in the cranial dura mater there is no extradural space, but sometimes due to fracture of the cranial balls, these middle meningeal vessels, they get ruptured and lead to the extradural hematoma. So the cause of extradural hematoma is the fracture of the cranial balls, which results into tearing of the middle meningeal vessels, which results into the extradural hematoma. So in this we can see this is the endosteal layer of dura mater. These are the between endosteal layer of dura mater and interior of the cranial bones. These are the middle meningeal vessels, and you can see the markings of the middle meningeal vessels here. The middle meningeal veins, they are very close to the interior of the bolt of the cranium. So the impressions on the interior of the cranial bolt, they are mainly caused by the middle meningeal veins rather than the middle meningeal arteries. Okay, so this much is for the interior of the bolt of the skull. Now, now you can see
sir,
here.
What is this?
So these are the granular foveolae, and here are the presence of the venous lacunae, which drains into the superior sagittal sinus. So this is now you can see here, after removing this cranial bolt, you see here this is the dura mater. This is the dura mater. So I have give one incision here to take out this flap of dura mater. You can see here I am giving incision so that I can turn out this flap like this. Okay, in the same fashion I am giving one incision here and one parasagittal incision so that I can remove this fold of dura mater like this. You can see here, and you are seeing here the same fold of the same layer, that is dura mater. It is already dissected out, so there is no need of this. So this is, I have reflected out the dura mater from the field, and you know the dura mater of the cranial cavity having two layers, the endosteal layer and the meningeal layer. Endosteal layer towards the interior of the cranial bolt, and meningeal layer towards the brain. And the sites where the endosteal layer is separated from the meningeal layer, this is the site of lodgement of the intracranial dural venous sinuses. Most of the intracranial dural venous sinuses, they are present between the endosteal and meningeal layers of dura mater at the line of separation. But there are some sinuses which are present in the infolding of the meningeal layer itself, and these sinuses are two in number. Number one, inferior sagittal sinus, and second is the straight sinus. Otherwise all the sinuses, they are present between the endosteal and meningeal layer at the line of separation, but only two sinuses, the inferior sagittal sinus and the straight sinus, these are the exceptions of this, and they are present in the duplication, or you can say the enfolding of the meningeal layer of the dura mater, cranial dura mater. Okay, now you see here this is the one fold of dura mater, and before going into the fold of dura mater, I must say this is the dura mater, the two layers of dura mater. Then you can see this is the this second layer. This is the this pia mater. This is the pia mater basically. This is the pia mater, and you know between the dura mater and the pia mater, or I must say between the meningeal layer of dura mater and pia mater, there is a space which is known as the subarachnoid space, and this space contains mainly the large arteries of the brain, which are going to supply the brain. They present in the subarachnoid space. So sometimes these arteries, they are dilated and abnormally dilated and tortuous, and their walls are become very thin, and this condition of the abnormally dilated and thin blood vessels, this condition is known as the aneurysm. Cerebral aneurysm, and this cerebral aneurysm is very prone to rupture, and it is a very life-threatening condition if very aneurysm is ruptured in the subarachnoid space. This is known as subarachnoid hemorrhage, and it is life-threatening condition. And the most important symptom of subarachnoid hemorrhage is the thunderclap headache or thunderclap headache. The patient complains you, okay, he never experienced such kind of headache in his or her life. This is the first episode, very severe pain. This is the symptom of the subarachnoid hemorrhage, and it is almost fatal. So the subarachnoid hemorrhage, the cause of subarachnoid hemorrhage is the rupture of blood vessels, especially the baryoaneurysm. What is baryoaneurysm? Baryoaneurysm means the abnormal dilatation and thinning of the arterial wall. Okay, so and after the arachnoid space, after the arachnoid matter, on the surface of the brain is the third layer of the meninges, which is known as the pia mater. And pia mater covers the surface of the brain, and it also covers the irregularities on the surface of the brain. These are the gyri and sulci. Okay, and it is firmly adhered to the brain surface and becomes part and parcel of the brain. Okay, this pia mater is also having two layers, epipia and pia glia. Okay, I'm not going in detail, but it is also having two layers, epipia and pia glia. Okay, so you can see, so this is the arachnoid matter, then the pia matter, and then the dura mater, then the arachnoid matter, then the pia mater. Okay, now you can see here, this dura mater forms 4 folds in the cranial cavity. The cranial dura mater forms 4 folds of dura mater in the cranial cavity. These folds are: number 1, falx cerebri. You can see here, this is the falx cerebri, which is invaginated into the medial longitudinal fissure which present between the two cerebral hemispheres. Second fold is the tentorium cerebelli. I will show you. Third fold is the falx cerebelli, and fourth fold is the diaphragma celli, which forms the roof of the sella turcica. And this hypophyseal fossa of sella turcica, it contains the pituitary gland or hypophysis cerebri. So there are, you must remember these 4 folds of dura mater. It is very important from your examination point of view. The dura mater forms 4 folds in the cranial cavity. They are: number 1, the falx cerebri; number 2, the tentorium cerebelli; number 3, the falx cerebelli; and number 4, the diaphragma celli. So now what I am going to do is I am giving one incision to detach the falx cerebri from the crista galli. Here is a fold of crista galli. I am going to give this. I am going to this. Now look at here. Please throw the light. You can see here, this is the attached margin of the falx cerebri. I am going to and so this is the falx cerebri. see here, this is a sickle-shaped fold of dura mater, and this is the falx cerebri. You can see here, this is the falx cerebri. You can see very clearly, and in the upper margin of the sickle-shaped fold, that is the falx cerebri, you can very clearly see this is the superior sagittal sinus here. You can see this is the superior sagittal sinus here. You can see very clearly, this is the superior sagittal sinus here. This is the location of the superior sagittal sinus in the superior margin of the sickle-shaped fold of dura mater, which is known as the falx cerebri. So it begins from the crista galli, somewhere here at the foramen cecum, and it goes up to the internal occipital protuberance where the confluence of sinus is present. So now in the inferior margin of the sickle-shaped fold, you can see here, this is the inferior sagittal sinus. This is the location of the inferior sagittal sinus on the inferior margin of the falx cerebri. On the inferior margin of falx cerebri, and I told you that the inferior sagittal sinus is present in the infolding of the meningeal layer of dura mater, not between the endosteal and meningeal layer of dura mater like most of the cranial dural venous sinus age. So this is the inferior sagittal sinus. Now I am going to remove the brain from the cranial cavity. Now you can see here, now hold this brain like this. उधर से पकड़ता हूँ बेटा. हाँ. Now look at here, I am going to take out the brain with frontal pole. I am pulling the frontal pole posteriorly to look the olfactory tract. Please focus the light here. Please focus the light here. Focus the light here. Focus. Now you can see very clearly here. You can very clearly appreciate. I am seeing here the olfactory tract. You can see the olfactory tract. One is this, and another is this. Can see?
Yes.
This is the olfactory tract. This is the olfactory tract here. Okay, you can see. This is the olfactory tract. Here you can see also. This is the olfactory tract. This is the olfactory tract. Okay. This is the olfactory tract, and here is the olfactory tract. Please focus the light. Focus the light. Can see? Can see the olfactory tract? Here? Can see? Here? And you can see this side also. This. I am going to cut this olfactory tract here. Look at here. I am going to cut this.
वाइटिश दिख रहा है वो है ना.
हाँ, yes. I am going to cut it from here. Just a minute. I am going to cut it from here. Now, the second structure. The second structure you can see here is the olfactory, the optic nerve. You can see here the second structure. Give the light. This is the optic nerve here. This is the optic nerve here. I am going to cut this from here. This optic nerve. This side. I am going to cut. Please focus the light. This is the optic nerve. I am going to cut from this side also. This is the optic nerve I have cut down. The optic nerve. Yes, this is the optic nerve.
Yeah?
Okay, this is the optic nerve. Now I am able to see the oculomotor nerve also here, and this is the internal carotid artery. Focus the light. Okay, this is the internal carotid artery. This is the internal carotid artery here. This is the internal carotid artery. This is the internal carotid artery. This is the internal carotid artery. This side. Please give the light. Give the light. This is the internal carotid artery of this side. Okay. Now you can see the oculomotor nerve. Look at here. Please focus the light. This is the oculomotor nerve here. This is the, okay, and this is the oculomotor nerve of this side. You can see this is the oculomotor nerve of this side. Okay. Now I am going to cut the attached margin of the falx of the tentorium cerebelli. I am going to cut the attached margin of the falx
cerebral. इसको हटा दो.
I am turning the head. I turn the head on the left side, and I am pushing my fingers below the temporal lobe, and I am trying to cut the fixed attached margin of the tentorium cerebelli. Now, please focus the light. Please focus the light. So you can see here, this is the attached margin of the tentorium cerebelli. This is the attached margin of tentorium cerebelli. I am going to cut this attached margin of tentorium cerebelli here. This is the attached margin of tentorium cerebelli. I have cut this side, means the right side. Now I am doing the same procedure on the left side, and for cutting the attached margin of this tentorium cerebelli on the left side, I am repeating the procedure. Means I am turning the head on the right side to cut the attached margin of the tentorium cerebelli on the left side. On the left side. Okay.
Sure.
So please hold this body. Okay, I am turning this head on the right side to cut the hold it like this. Turn the head on the left side. And I am going to do the same procedure on the left side. Please focus the light so that I can see the attached margin of arc cerebelli. Please give the light.
लाइट पीछे इधर से दे दो. उसमें अंदर जानी चाहिए.
Please give the light.
इसको पकड़ लूँ.
ज़्यादा नहीं खींचना, टूट जाएगा. Now give the light, please. Yes. Now I can see this is the attached margin here. Yes.
दिख रहा?
This is the attached margin. Focus the light here. Yes.
एक जगह फोकस हो, एक ही तरफ से दिखा पाओगे बेटा.
Okay. Now I am allowing the brain to fall backward.
सॉरी.
Please focus the light.
लाइट.
Yes, very good. Same person, please focus the light here also. Yes, very good. Yes, very good. Please give me the light, please.
लाइट दिखाओ अंदर.
Now you can see this is the pons, and below the pons is the medulla oblongata, and I am in the vertebral canal. So actually for
जिस पकड़ो वहाँ
So
खींच नहीं.
I am going to in the vertebral canal, and I am going to cut the medulla oblongata as distant as possible. Here if
लॉन्ग हैंडल नाइफ विल बी
long handle knife will work better.
सुपर हीरो.
Here you can see the superficial cerebral veins, they are draining into the superior sagittal sinus, you can see. Okay, but I have to cut these vessels here. So this is the brain in our hand. You can see this is the brain. Very nice brain is here. Okay, look at here. This is the brain. And thank you, Dr. Sandeep.
Thank you, sir.
For assisting me, and all the students. So this is the brain here. This is the brain here. You can see. So this is the whole procedure of taking out the brain from the cranial cavity. the most important step in taking out the brain from the cranial cavity is to cut the attached margin of the tentorium cerebelli, because it is deeper, and if you fail to cut the attached margin of the tentorium cerebelli, and if you try to take out the brain, what will happen? It simply happen that the cerebellum will detach from the cerebrum, and it will remain into the infratentorial compartment of the cranial cavity. You only take out the cerebrum only. So this is very important, because tentorium cerebelli attached margin somewhere here. So I have cut this attached margin from here and also from here to free the attached margin of tentorium cerebelli, so that it will become easy to take out the brain along with the cerebellum. Number one. Second, the important the catch point of taking out the brain from the cranial cavity, you must cut the cranial bones as below as possible, so that you will be very close to the this petrous temporal bone, very close to the petrous temporal bone. Because I have cut it at the lower level, so I am very close to the this attached margin, this superior margin of the petrous temporal bone, which is the site of attachment of the attached margin of tentorium cerebelli, so that I can easily poke my fingers to lift out this orbital this temporal lobe, and to see the attached margin of tentorium cerebelli, and will become easy to cut it out. So this is the whole procedure to take out the brain.
Sir, please explain the major part of this.
Thank you.